But we're going to go pretty quickly through this just because we want to get to the renal stuff too, okay? So some of this is overlap, right? So we talked about the infective endocarditis, we talked about rheumatic heart disease. Just remember, what you need to remember is pretty much what the first line bacteria or causal agent is for these different lesions, right? And remember, affective endocarditis, Osler's nodes are tender, Janeway lesions, hands and palms are going to be non-tender, and raw spots show up in the eye. So they'll typically give you that for infective endocarditis. I used to make a big deal of trying to remember this criteria, but I've never come across problems where they're like, did they technically qualify with the major and minor? So, that's my 2 cents on like, actually learning these like this and stuff. So, right, so this would be a very important slide for the native valve endocarditis. What's going to be most common? Remember, they like to talk about IV drug users. Remember, that means they're injecting, either using a needle to inject directly into their venous system. So that Staph aureus that's on your skin gets in there. The first valve that Staph aureus that was recently injected gets to is the tricuspid valve. So classically, if they talk about either an IV drug user, or sometimes I'll say people that are on hemodialysis, because they have to get a lot of, to do hemodialysis, you have to have venipuncture. So they'll talk about that valve. It's typically Staph, right? Okay, so here when we're looking at endocarditis, we have strep, enterococcus. Those HASEC organisms are like 5%, not terribly important. And then prostatic valves, you could see the Staph is very common here. Even the coagulase negative ones. Remember, strep viridans, if they ever talk about a patient that had a recent dental procedure, they have to be, and they have a heart valve transplant, they have to be on significant prophylaxis, okay? Because that strep viridans in the mouth is can lead to infective endocarditis. I think they're having a party outside. I don't know, in my apartment. Anyway, yeah, so you see here, Staph and strep are the big ones. So if it came down to it, pick between those two. All right. And then these are just characteristics of the bacteria that you learned about before. And then these are strep viridans, mutans, and sanguinis. And remember, those are dental procedures or bad dental hygiene. All right. All right. Let's see. Yeah, so rheumatic heart disease. Remember, you have typically a kid had a recent sore throat, week or so later, getting heart problems. It's that molecular mimicry. Remember, when you go and test these kids to see if they have rheumatic heart disease, they will not have strep pyogenes in their blood, okay? The blood cultures will come back negative. It's very important because the strep pyogenes is not causing the actual damage to the heart valve, particularly the mitral valve. It's actually this molecular mimicry. The body makes autoantibodies that attack the valve, similarly to if rheumatic heart, or excuse me, if they would attack the valve similarly to if strep pyogenes was there, but the blood cultures will come back negative, okay? You can see enterococcus also, right? Both different valves. What did we get to? Okay, let's see. And then these HASEC organisms too, right? So those are 5%, so not terribly important, but if they come up. All right, and then myocarditis, you can see here, it's obviously the muscle tissue. Viral causes, you need to think of Coxsackie B. B is for body, Coxsackie A does like hand, foot, and mouth disease. So remember, Coxsackie B is the big one here. They have fungal causes. Remember, fungal infections, typically the patient has to be immunocompromised. So if they say immunocompromised, they're probably leading you down the road to go to a fungal infection. Trypanosoma, Chagas disease. Remember, when I think trypanosoma, I think dilation. It causes dilated cardiomyopathy. Okay, so that's what that's going to cause. It's South American Chagas. Toxoplasma as well, immunocompromised. That's when we talk about, isn't that the cat? I think that has to do with the cat feces, toxoplasma. Yeah, I think so. Don't correct me if I'm wrong. Okay, pericarditis. Remember, if you have this friction rub, when you listen to the stethoscope, with the stethoscope, it feels scratchy. You can get effusions there. Typically they'll say the patient feels better and relief when they're leaning forward. Okay, that's classic for pericarditis. You can see both Coxsackie B, A and B there, and then some other viral causes classically. Even some immunocompromised, some fungi and stuff. All right, and then here would be a good summary slide for everything. All right.